This is News Channel 8, covering today's breaking news in Oklahoma with Carol Lambert, Mark Bradshaw, tracking storms with the power of Doppler 8000, Chief Meteorologist Frank Mitchell. You're watching News Channel 8 at 4:30, coverage you can count on.
Welcome back. This afternoon, we're going to take an in-depth look at bone cancer. As you know, Wayman Tisdale passed away last Friday after a battle with bone cancer. So what are the signs, symptoms, and treatments available for others suffering from this condition? With us today is Dr. Simeon Jaggernauth with Cancer Treatment Centers of America. Unfortunately, there's interest in something like this when somebody well-known like Wayman Tisdale comes down with this and in his case passed away with it. First of all, what is bone cancer?
Okay. Bone cancer is a disease that actually starts in the bone itself. Now there are other types of cancers that go to the bone, but they're not primary diseases of the bone. When we talk about bone cancer, we're talking about the hard shell on the bone itself. And the bone can be anywhere, such as in the skeleton, the ribs, the long bones, arms and legs, and so forth.
So you can have cancer that spreads to the bone. That's not bone cancer, but bone cancer starts in the bone.
Starts in the core of the bone itself. Now, there are also diseases in the bone, such as in the bone marrow, and those are called the liquid cancers, such as leukemia, and that's a different class of disease by itself. This is dealing all with the hard shell of the bone itself.
And I understand it's not that common.
No, it's a very rare cancer, about 2,500 cases in the United States every year. Very rare in itself. You know, you're more likely to see cancers that start from other places, such as in the prostate that spread to the bone, but it's still prostate cancer, or breast cancer that spreads from the breast to the bone. That's still breast cancer. Even though it involves the bone, it's not of the bone.
What are the symptoms, the signs here?
Very vague, very non-specific. They can be anything from arthritis, joint pain, you know, fractures which are unexpected for any reason. In his situation, we saw that he developed a fracture which then led to his diagnosis. Now, if you have any of those symptoms, such as weakness, weight loss, anemia, or just a fatigue level that is not improving over time, then further evaluation is definitely warranted.
What is the rate for recovery for somebody coming down with bone cancer?
Well, you know, the recovery really depends on the treatment that's rendered. If you have, let's say, a very early stage or an early grade disease, then it could be resected, then it can actually, they can recuperate. And the recuperation can take anywhere from for less than a couple of weeks to maybe a month or two. But then again, for those who have disease that has spread to the bone, that treatment is much different than for the primary bone
We
disease.
are certainly learning more about bone cancer, unfortunately, you know, with the passing of Wayman Tisdale. But Doctor, thanks very much for joining us this afternoon, and certainly a topic a lot of us want to know more about at this time.
Absolutely.
Carol?
All right, thank you, Mark. Well, up next, an earthquake rattles through Southern California. What forecasters are now saying about the force of the aftershocks the state could still be facing.
And look at those metro temperatures. Beautiful weather. Sunshine at 75. I'll let you know if you can expect this all week long.